Hi, I'm back again. Okay, this time I'm in my mother's room and I'm going to show you a few of the other things that I had to do to adjust. Now, I told you in my first video that in July of 2022, I retired and I became an at-home full-time caregiver for my mom. And this is my mom, okay? In August of that same year, my mom became very lethargic and she just was not acting herself. So I went on and called the ambulance to get her, and they took her on to the hospital. At the hospital, we were informed that her potassium was extremely low, her sodium was too high, and a few other things that were going on with her. Okay? When we got my mom home from the hospital, she walked herself, got out of the wheelchair, got in the car. We got her to the house. She walked in the house. That next morning when I woke up, I went to get her up so she can go ahead and bathe. So it's time for her to eat. And my mom was having difficulty walking. She had forgotten that quick how she was supposed to walk. So now everything that she was assisting with doing now were tasks that I had to do. The incontinence, so I have to clean her up. She stopped feeding herself. She's no longer doing that, so someone has to actually feed her. And it's a lot of things that we had to do. So because of that change, I had to come up with some more things now to assist my mom. And one of the first things I did was I purchased these kind of pads like this. I'll see if I can put a description of them on my page, because I got most of the stuff I get from Amazon. And these are bed pads that you get. These are the ones that I purchased. And while at the hospital, when they released her, they gave me some additional ones. These are a lot thicker than the ones that I originally purchased. So I was going to look into getting some more of this brand because I really like this brand. With this brand, I only have to put one on her bed at night. With this one, I have a habit of I put two on her bed in the evening. Another thing I purchased from my mom were the LivDry. These are protective underwear. I got these for my mom, and these come in so handy. So I'll make sure I have these for her, and I have them on automatic reorder on them from Amazon. I got those for her. And since she was no longer walking on her own and she's in her room most of the time, I purchased a humidifier for her. And this is the humidifier that I got. This helps to keep the temperature balanced in her room, and also helps her so she doesn't have the bad colds or to develop pneumonia. It helps to keep her lungs clear and keep them open. That was the benefit of this, and it comes in very handy and it's very beneficial. What I also got for her, I'm going to slide over some so you can see it because it's connected. I purchased the PureWick system. You can look that up, and I purchased that directly from the manufacturer for PureWick. What PureWick does, it's like a wand. And I'll show you what the wand looks like. This is the wand. I'll do a close-up of the wand for you. That is the wand that I got. And this wand, this goes between her legs, inside the underwear. And every time she urinates, this catches the urine and it goes into this canister back here. So that's very good, and it's it made such a big difference, me going on and purchasing this for her, because that meant she was staying dry more often instead of her just sitting in that urine all day. She was dry. So this is very beneficial. For those wands are very costly. So what I started doing was I cleaned them myself. When I take them off of her, I soak them in bleach and detergent, and I thoroughly get them clean. I do that, and then let them go ahead and air dry out, and then they're available for me to reuse them. If you want to go ahead and purchase them, I believe for a pack of 30 was running like $135 for a pack of 30. And I think it costs more on Amazon. Okay, that's just a heads up for that. And then one other thing that I got from my mom, or that I use on her daily when I am changing her. I use this gadget here. It looks almost like a little wheel. And I'm going to end the video, or try to end it maybe, by demonstrating how I use this. It came like this. And what I did was I used a bungee cord. I used the bungee cord because I noticed when I turned my mom with it, her legs would sometimes try to slide out of it. And I just have to keep putting her legs back in it. So this came in very handy. And what I noticed on Amazon is now there is a provider out there that makes this, and it comes with something already attached. So you don't have to worry about doing this. But this works for me. And I'm going to demonstrate for you, or to you, how I actually do it in the morning when I'm changing her, all right, or getting her cleaned up. I'll show you the basic of the routine that I do, and you'll see how easy it works when I'm doing this. I'm going to move her table out the way, because as you saw the table that I was on, that's one of the hospital tables that they have in it when they're feeding the patients. I purchased one of those. That comes in very helpful and very handy also, since I'm actually feeding her. I don't have to hold the food in my hand. I utilize this when I'm feeding her. You take this part here, the green pillow. What I do first is, because my mom also has a hospital bed, since she was no longer mobile and moving on her own, the insurance covered for her to get a hospital bed. What I had also got for my mom prior to her getting the hospital bed was I got her an air mattress. A mattress that sends signals and bubbles up and down to try to lower the pressure point, or the time she spent on the different pressure points in her body. That is very, very important. In her last visit in the hospital actually contacted the insurance company, so the insurance company delivered an air mattress for her. I had just the topper piece that goes on top of it that I got from Amazon, and that was working some, because some other stuff happened from her going back and forth in the hospital. I was doing this at home, but the hospitals weren't doing it. They didn't have the air mattresses at home. At the hospital. So when we would take her to the hospital, they weren't turning her and rotating her body as much as they should have. So by the time she got home, and then the next time she went back to the hospital again, I would bring it to them their attention that she's developing these little marks on her backside. The hospital was so concerned with dealing with her current state that was not their focus. So by the time we got her all out the hospital, last time she was there, she wound up having to have surgery to remove the dead skin that was there, which caused an open wound on her backside. And the open wound required me having to use a wound vac on her. She had the wound vac just for a little while. My mom has allergies to adhesive, and with the wound vac, it required a lot of adhesive. And what the adhesive started doing, it started pulling her skin off of her whenever you had to change the wound vac out. So I told him, no, I don't want to use the wound vac anymore. We have to work around that and do it another way. And that's what we wound up doing. We came up with some other plans to do it. We did the wet-dry method on her, and that really, really worked. So a wound that started off being about this wide, from the care that I've been doing, and with some assistance with a wound care nurse that comes to my house now once a week, She comes beginning of the week, and we come with a plan that we're going to use all week before we adjust what we're doing. That wound is now about that big now. It's down quite a bit. So it's about there right now. So it went from being this big, coming all the way across her behind, to about that big now. So it's reduced quite a bit. And the other stuff that I have been using to help her skin to avoid any more wounds coming, I've been using AD ointment along with Aquaphor. And I also use a little bit of bacitracin. That's an antiseptic, and that helps too. Like if you start seeing any kind of wounds like they're trying to develop, it helps to heal her body. That, and I also make a butter with shea, mango, and cocoa. And I have oils that I put in that butter that I use. And I use that on her skin, so her skin looks flawless now. It's nice and smooth, besides the little wound there. And it keeps shrinking and shrinking and shrinking. I needed to get to the point in which we feel comfortable transporting my mom via wheelchair to the car to our destination. Because the cost of having to transport a patient that is not mobile in a stretcher runs over $1,000 one way. So that can be very, very costly if she has to keep going back and forth to the hospital. Okay? So those are some of the things that I use with my mom, and they really work. And I also purchased several gloves. I purchased different sizes, the medium, large, and the small for the rubber gloves. So when I get up in the morning and I'm getting ready to clean her up, I do have pants on my mom. So I'm not going to show you, so you don't see any part of her body really being displayed. I don't want that, because this is supposed to be, not supposed to be an X-rated video, and I don't want it to be an X-rated video. So what I do with my mom, I get a pair of the underwear that I said. I'm going to set this on her table just for a moment. I take the underwear, I put them, yes, Mom, on her. I prefer these over the ones that you have to go and snap them. Some of you might prefer using that one. It looks like a pamper and you put it on that way. For me, those weren't secure enough for my mom. So I put them on a little past her knee. Once I put them on past her knee, I grab this. I lift her legs gently. I slide that under her legs with one leg going through each one. See as there, how her legs are? One is in each side of it. Then I move it up. Just like that on her. I take my strap, put it across there. And see, that's on her now. And then when I get ready to turn her, I say, okay, Mom, we're going to turn you. But before I turn her, I'll make sure that she's laying down all the way. So I'm going to put her head down. Like that. I take my hands in this part. I let her know, okay, Mom, we're going to turn you over some, okay? She likes to grab hold when I'm doing that. Now, let's turn you. And see how easy she turns over? Now, once my mom's in that position, the pad that's under her, if I'm going to change it, I'll roll it up this way. I'm just demonstrating right now. I'm not going to change it because that's a new pad. I take the new pad. I roll the ends down. I put it underneath the one that I already rolled up partially. It goes underneath there. Just like that. Then I go ahead and I take her. I walk around to the other side of the bed. And what I forgot to do, I forgot to put the underwear on her. So let me pull the underwear up on this side of her. And now I'm going to turn her over. Mom, we're going to turn the other way. Roll it. See? So it's no strain on my back or anything because I'm just rolling her over. Now I'm going to roll you on the other side, okay? Now grab that side. Now see? She's rolled on the other side. And I can grab a hold of the underwear, pull them the rest of the way up. The pad that was under her that I rolled this way, now I can remove that pad, rolling it up, and I can unroll the other pad. So now she has the brand new pad is now under her. As I stated, this pad is clean, so I'm going to go ahead and re-roll this pad back. And you see how I do it again. I'm putting the old pad back here. Put that partially under her. I'm going back around again. Okay, Ma. We'll lay you back down again. Thank you. Let me have this hand. Yep. And we'll lay you down. All right. Let me roll you one more time so I can remove the clean one. This is the clean one that I had. The clean one I will put in her head of her bed. So when I bathe her in the morning, I already have that there for her. Now I'm unrolling the other one. That's back in place that fast. Now I'll roll her back over. And as you know, I'm going to take these underwear off because she doesn't need them on. The same way I got them on her, I get them off of her. Take that side. Come back to me one more time. Loosen this hand. Thank you, ma'am. Rolling. As you see, I'm still rolling her. So it's no strain on me. I'm just taking the underwear the rest of the way down. Then I unhook it. Slide it down between her legs. Lift her leg up. Pull it from underneath her. Now I can remove this pair of underwear that were just as a sample pair. Now those are all for her. She is all cleaned up. She's changed. I take the orange roller piece. I put it inside the basket that I have here for her. Now I want to take those off of her once I turn the camera off. Okay? So that's basically how I do when it comes to using this unit right here that I purchased from Amazon. Okay? Yeah. And my mom is saying yes also. All right? You want to wave at the camera, Ma? I'll set you up. She's coming up now. I can't guarantee that she waves. She might not. You want to wave, Ma? Take your hand. Alrighty. Until next time. She's laughing. All right. Bye.
Bye.
She said bye.